Hi, I'm Sam. I work at PhysioFusion. PhysioFusion, for those of you who don't know, we are a multidisciplinary clinic based around physiotherapy, but we have medical consultants, podiatrists, and so on. However, today we're going to talk about COVID, more specifically long COVID. We have a large base of clientele that come to see us, so we're seeing people with long COVID almost despite the fact that they're coming in with other problems. And we have a high level of COVID compliance that we have to have within the clinic, as you can tell from the masses of COVID-based hair and the nice red line across my nose, because of wearing masks constantly. So long COVID is incredibly prevalent. We have people who are coming to see us well in excess of 12 weeks since they've had COVID with symptoms, and the recent news articles estimate that the UK has over 1 million sufferers of long COVID. That seems like a heck of an amount, isn't it? But once you realise that long COVID is basically just described as having COVID symptoms for longer than 12 weeks, you can see you would quite quickly get to 1 million people. But the symptoms vary. They can be more mild or they can be a lot more severe. Some of us will probably know someone with lots of severe symptoms and they struggle with high levels of fatigue, they're feeling constantly run down, and that impacts onto other areas. And there are 7 main areas that COVID, the virus, affects. His list, but they are specifically high in the levels of breathing, on lung function, and then fitness that comes with it. The other areas are slightly less common, albeit still very important. And because of us seeing so many patients with long COVID, not deliberately, they are coming in with many other conditions, we decided to set up a long COVID assessment and treatment service. And plainly because we couldn't find anyone else who was running that service when we were trying to refer our patients. There are some services that are now set up in regional centres, and they are very much appear to be for the severe COVID sufferers. So they're certainly not seeing the 1 million people that are out there with long COVID symptoms. Our service is based around 3 key principles. The first one, quantifying the symptoms that you have. Every single sufferer of long COVID has different symptoms and different levels of symptoms. It's astounding. The second one is screening to make sure that your symptoms are definitely from long COVID, and not from another issue. You can get symptoms you feel are from long COVID, and they're not. They're from something else. It's very, very important we don't miss symptoms that might be from something else. And then the third feature is, from both of those pieces of information, designing a treatment package that works specifically for you. If I gave someone with long COVID a treatment plan, and then they said to any friend they had with long COVID, do my plan, it's going to be great for you. Absolutely, it might not be. Their symptoms may well be totally not suitable for the treatment plan that you've got. It's a tailored treatment plan for you, with some good advice in there, no doubt, that will apply to all, but it will be tailored specifically for you. There are a few absolute givens. The first thing is that you will be given a document to fill in. It's not War and Peace. It's more like yes, no questions and a few rating questions. But because the symptoms are so different in everybody, so much information to gather. And these questions might be related to, do you suffer from this symptom? Do you suffer from that symptom? But it also asks you to rate things like the level of your breathing, and any other factors that it may well have led to. Do you feel like you have poor mental health, for instance? It's just to gain a bigger picture of your symptoms, so that when you enter the room with your physio, that physio's already got a raft of information available to them, and then they can clarify and drill down into points that you might have raised in that initial questionnaire. And then it leaves a lot more time in the assessment for you to do the physical testing. Now that physical testing includes testing lung volume and lung function. It also includes analysing how you breathe, which sounds ridiculous, I know, but a very, very large proportion of people that we have seen, 95% plus, have a breathing dysfunction following COVID. In essence, it means they're not breathing normally. Again, I know it sounds ridiculous, but part of what physiotherapists are taught is about teaching people how to return to a normal breathing style. It's not that easy to Google and to do off Google. You may well need someone to feel and show you different areas on your body so that you can return your breathing system to a normal. Why is it important to seek help? Because it's always a good idea asking for help. Please don't suffer in silence. If you've had long COVID, so you've got something for longer than 12 weeks, you might find that your symptoms just do not evaporate into fresh air quickly and easily. Come and see us. Come and find out more about your symptoms and why. Come and find out what you can do. Come and find out what we can do. It's one of those things where you don't know how helpful a service can be until you've gone into it and you're working with your physio and you can start to feel the differences. If you're suffering from long COVID, it's an upsetting thing to suffer from. It affects you physically, mentally, it affects your home life, your work life, your family life. Please don't suffer in silence. Come and see us and let's start to move forward together.